Hi, this is Dr. Dannenhoffer, the Public Health Officer from Douglas County, sporting one of my new balaclavas here. This one seems to go okay with my shirt, although I do have no sense of style. So anyway, this balaclava has been great. I've been using it, but I'm going to take it down now for those who are lip reading. Again, Dr. Bob Dannenhoffer. So today is Friday, July the 10th, and I wish I had great news. I was hoping that we get to this point of the world and we did say, hey, let's go to once a week or let's go to once every other week because this was kind of under control. But that's, unfortunately, I can't tell you that. So this is still a very, very active pandemic in many places around the world. We have 12.6 million cases. So we've been increasing the number of cases at a very much accelerated rate. So we had never been over 150 cases a few weeks ago, and now we've been over 200,000 cases many days this week. We're still at 562,000 deaths. So the death percentage is going down, but the total number of daily deaths continues to increase. This is a very active pandemic in the U.S. and Brazil, many places in the Middle East. India is really, really getting prominent place for it. They still have a very high test positivity rate, suggesting they're only finding a fraction of the cases. So when all of the cases do get known in India, I'm really afraid that we're going to have an enormously high number. In the U.S., we had today, I almost can't believe this number, but 71,000 cases today, and the day's not even over. So 71,000 cases is about 10,000 more than our previous high. That is an extraordinary number of cases, and that is not due to increased testing. While we've had some increased testing, this big increase in numbers is because there's really, really, really increased disease. Now, this increased disease is mostly in Texas, Arizona, Louisiana, Georgia, Florida, and California, but the rest of the states are also seeing an increase. So this is not just in one little area of the country. When you look at the heat map of the country, the places where we're having increasing cases, there's only a few states around that aren't having a rapidly increasing number of cases. So it's very, very, very worrisome. And indeed, while the death rate in the U.S. had gone down, and we had gotten down to 500-600 a day, in the last few days it's come up, and yesterday was almost 1,000. Today will likely hit 1,000. And so lots and lots of deaths along with the illnesses. Now again, 1,000 deaths with 70,000 new cases is a low case fatality rate, but with that many cases, even a case fatality rate of 1 or 2% is still lots and lots and lots of deaths. We're also starting to see in the areas down south that they're beginning to strain the system, big long lines for testing. We're starting to see hospitals say that the emergency rooms are full. I was reading a story just an hour ago from Houston saying that there's no place to put people in the hospital when they get sick. And so this is incredibly, incredibly worrisome. Now in Oregon, we're doing better. We had a lot of cases. Yesterday was our highest day ever, but we're at 200-300 cases a day every day. And those cases, some are associated with outbreaks. Again, most are in the areas around the Portland area, but we're now starting to see a lot of cases in Eugene. We're starting to see a lot of cases in the Gorge, and we're seeing a lot more cases here in Douglas County. And so this is worrisome. So we've gone almost a month with almost no cases, but now we're starting to see an increasing tempo of cases, 1 or 2 or 3 cases a day, some confirmed, some presumptive. But the other thing we're seeing is that our testing is way delayed. So we were a month or so ago that our testing, we get almost all the results back in a day or two. We had one positive test result relayed to us this week that took 11 days to come back. There are a bunch of tests we're waiting on from the 3rd of July, now a whole week waiting for those results. So this is starting to feel very uncomfortable with these long delays and with an increasing number of cases. But still, if you look at all of it, Douglas County is doing a whole lot better than the rest of Oregon, and Oregon is doing a whole lot better than the rest of the country. So that's a good sign. But my worry is that many of these cases are related to travel outside of the county. And as long as people travel to these other areas where there's lots of disease, they're going to bring it in. And so these cases have been associated with travel to California, to Washington, to Alaska, to Nevada, to Idaho. And so that when people come in from these other areas or go to these other areas, then come back, and there's a lot of disease there, it's inevitable that some are going to bring it back. So please be careful about your travel. Okay, so a couple of questions. This is really your time to ask questions rather than me just to talk to you. So Mandy says, I work at a school. What's your opinion of school starting? Well, school starting is a really controversial issue. And let's separate this out from higher education, high school, and elementary school. It looks like elementary school is likely to be the safest of the three for a couple of reasons. One is little kids seem to get it less. Little kids don't tend to stay in one classroom the whole time. And for that reason, we think that elementary school is going to be safest. When we look around the world, when other places have started elementary school, they've done well. Once we start to get to high school and college, it's much more dicey. In high school, kids have multiple classes, passing periods, lockers, sports, all of those kinds of things that increase mixing, as well as teenagers get this disease a whole lot more than kids in the K-6 time. So I don't know what's going to happen there. There are plans to open colleges, but colleges especially are worrisome because of the amount of mixing that they do. So we'll see. The American Academy of Pediatrics says that if it can be done safely, we could open schools. I'm on this governor's Healthy Reopenings Task Force. It's a very cautious group. We'll see what happens there. And so we'll see what happens about school starting. Now, in all the other countries that have started school, they've started school at a time when the disease was really quiet in the areas where they restarted it. So, for example, Japan closed schools early and then opened them up when the disease incidence got low. Korea had low incidence in the area where they opened schools, and China didn't open the schools until the incidence was almost zero. In this country, it's a little different because the incidence is clearly not close to zero, and with that, we worry about schools reopening, so we'll see. So Kathy says, if droplets could spread COVID, why does the test need to be done in the nasal cavity? Well, you need to find the virus, and the question is, where could you find the virus? Could you find it in saliva? Boy, that would be great because it would be so much easier to collect saliva than nasopharyngeal swabs. But right now, the saliva tests are limited to just a few platforms. And the platforms that we have available to us in Douglas County, it needs to be, the sample is best done in the nose. But yeah, it would be great if you could go ahead and do a test where you could spit in a cup and figure it out, but we don't have that available to us yet. So CDC just released that COVID is 2 times more deadly than the flu. I don't think that's the case at all. So, the best data suggests that this disease is at least 20 times more deadly than the flu. Very good data there. And very good data from a Mount Sinai study that I just saw. They suggested it was 70 times more deadly than the flu. So this twice as deadly as the flu. I don't know where that comes from. Erin, if you do that, please just send us where you got that. So Crystal says, is COVID mutating? And yes, COVID is mutating all the time. Like any virus, as it gets replicated, there are little errors in the replication, and those little errors in the replication are what we call mutations. Now, in many cases, the mutations are a nonsense mutation, and the new mutation dies off. But sometimes the mutation makes the germ stronger, and then that one does tend to continue. So there's a mutation to the 614 gene, and that mutation of the 614 gene does seem to be taking over. This mutation does seem to make the spike protein more stable, and by making the spike protein more stable makes it more infectious, although probably not more deadly. So if you get the infection, your chance of having a bad outcome is the same, but your chance of spreading it is higher. So we think that's happening. This has been somewhat controversial. There's some people who say this hogwash doesn't exist, other people who firmly believe it. I read a story today so that was pretty, I think, pretty well done, that suggests that it is mutating and it's more infectious, but I did not see anything that would suggest it was more or less deadly should you get it. Okay, so this note from CF Fink, please talk about the recovery rate in asymptomatic. You're not being positive enough. Testing creates more positives, not a higher death rate. So I don't know if to put all that together. So yes, when you do more testing, you will find more cases. Not surprisingly, if you didn't do any testing, you would find very few cases. So yes, as you do more cases, as you do more testing, you'll find more cases. But the number of cases you find is the number of tests you do times the positivity rate of the tests that you do. So we got to a point in May where our positivity rate was less than 1%. That is, we would do 100 tests and find one or fewer cases in that. Now the positivity rate in Oregon is over 4%, and I believe this week you're going to see is over 5%. So even though we're doing more cases, we're finding a higher percentage positive. So yes, we're finding a lot more cases, and the death rate is going down. We think the death rate is going down for 3 reasons. One is that I think the treatments for COVID are working, and we're starting to see a lower death rate. There's an article in the Oregonian today suggesting that we're just learning better how to treat the disease, and by learning to treat the disease better, the death rate is going down. But the deaths are not going down, so that there actually are more deaths now than there were 2 weeks ago. So the deaths aren't going down. So really, I know people want to argue statistics. I know statistics better than almost anyone. Don't get swayed by the fact that some people are saying, "Oh, this is just because of more testing." It absolutely, positively, without a doubt, is not. You're trying to tell me that all of the ICUs in Houston are full simply because they're doing more testing. You don't go into an ICU just because you had a positive test. You go into the ICU because you're deathly ill. So there are more people who are deathly ill. And anybody who wants to dispute that really just needs to talk to the doctors that work in those areas to know that there are more and more very, very sick people. This is not about just an increased positivity rate. All right. So is COVID mutating? Yes. Let me see what else we get here. Yeah. So Leanne says, can you speak to what scientists are learning about aerosols? So droplets are those tiny little things that you spit out that are really small, and they go 3 or 4 feet and then hit the ground. And we think that's still the predominant way that this is spread. But we've worried that aerosols were a problem here. And the reason we worry that aerosols were a problem is because you did see this big spread among these super spreader groups, like this choir practice. I mean, there's no way you could get 50 people within 6 feet of this person. So presumably some of the virus was in aerosols and moving to the other side of the room, as well as the rapid spread that we saw on the ships, the aircraft carriers, the cruise ships. It really made us worry that there would be aerosols. Now, early on, the WHO said, no, we still think the predominant way, we're not sure about aerosols. In this last week, 200 scientists said, look, it's time to get past that. It's time for us to recognize that aerosols are likely one of the ways that this can spread. And I would totally agree with that. And so I think we really need to be careful. What does this mean? Well, it does mean that we still want to be cautious about people who are in close contact, because almost all of our cases, we get somebody who's a family member who was in close contact and there are droplets. But then there are these occasional cases you don't know where they come from, and they could be related to aerosols. So what does that tell you? Well, that tells you to avoid crowded places. The more people there, the more crowded it is, the more it's indoors, the more the chance that an aerosol will be created and you'll get it. It also means a difference for people who are going to be really close to you. That is the anesthesiologist who's going to do your surgery, or the nurse who's working with somebody in the ICU, because they will be exposed to aerosols and they really need an increased level of protection so they don't get sick. However, I don't think aerosols are going to be the predominant part of spread because there have been a lot of people working in ICUs, most of whom have not gotten sick, suggesting that if aerosols was the predominant way, everybody in the ICU should be sick, and we haven't seen that. So Rob says, why don't report recovered anymore? This is the question we've been answering many, many times. So let me tell you the story again for those who haven't heard it. Those who've heard it, bear with me. So the story is, we used to use the definition of recovered as being no longer acutely infectious. So you're either acutely in isolation and still infectious, or you were recovered, and those were the two areas you could get. Well, that didn't make a lot of sense. That's the way we do it for many diseases, because for many diseases, it works like that. So the story with chickenpox is, you're sick during the time that you're infectious, and by the time all of these things have crossed over, you're usually no longer sick, and you're no longer infectious. So for many diseases, the end of the infectious period and the end of the active period are the same things. Not so at all with COVID. We do know now that people are usually not infectious 10 days after they have the illness, but there are some people at 10 days who were never sick at all, and then there are people at the end of 10 days who are still deathly ill. So calling the end of the active period or the end of the infectious period or the end of the isolation the same as recovered, as we know more about the disease, makes no sense. So early on, we had our number of recovered. So at one point, the numbers were something like 32 cases and 30 recovered, which meant that there were 2 active cases. Well, around the country when they've looked at that, the definition of recovered has changed, and they looked around the world, and it's got multiple different definitions. And since it has multiple different definitions, Oregon decided that it was going to come up with a uniform definition for recovered, which was 60 days after onset. Well, that's very different from what we said before, and if you use 60 days after onset, what you'd see is that the number of recovered would make very little sense, because it would suggest that the number of recovered went down. So that's why we stopped reporting it. So please forget about the recovered. What people really want to know is how many people out there are still with active disease, and we have tried to give people that information by saying the number of people in isolation. So the people in isolation are people who have had the disease and are still acutely symptomatic, or maybe if they weren't symptomatic, are within 10 days of their positive test. That's really the number which is important in the community, how much active disease is in there, and the number is high now. You'll remember at the one point when we said there were 30 recovered and 32 total cases and 30 recovered, we would suggest there were perhaps two active cases in the community. The number today was 18, I think, something like that. So there's a lot of active cases in the community. There's a lot of disease out there. People should get off this whole recovered thing and just recognize there's a lot of active disease out there. We have to redouble our efforts to stay safe. Please, please, please think about travel. Please think about social distancing. Please think about indoor gatherings. These are the areas we're really starting to see lots of spread. So somebody says, I work in a motel. Am I more at risk dealing with out-of-towners? Absolutely. I mean, the disease prevalence is low here in Douglas County. And that's given us some kind of like, oh yeah, why are we worried about this? We haven't had any deaths. We only have one guy in the hospital. I don't really know anybody who's been sick. But if you go to Houston right now, that's not what they would say. There are a lot of people in the hospital. There are a lot of people dying. There are a lot of people who know sick people. So yes, you're a little more at risk in dealing with out-of-towners. And so for people who clean rooms, I think we want to be safe. And my recommendation would be to wait 1 hour after they leave. In that time, aerosols go to the ground. So if you're worried about aerosols, that would come down. I'd certainly recommend that you wear gloves and everything that you do. And certainly then otherwise clean the room as well as you normally do. I'm always incredibly impressed by people who work at motels, how good they are at cleaning the rooms and what an incredible burden some of them do. You know, they clean 20 or 30 rooms a day. That to me is just amazing. So yeah, be careful. If you want to wait an hour after the people leave, I think that's perfectly reasonable. So Kathy said, I've heard of young children getting very ill recently. Is this true? So there are two ways that kids get ill. So kids can get ill from the actual COVID itself. We've not seen much of that, although as we have more and more and more cases in the U.S., there are obviously going to be more cases in kids, and we're starting to see some deaths in the 0 to 10 age group. So China had no deaths, but as we now have many, 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 many times more illness, yes, you will see some severe illnesses in that, but still the rate is extremely low. So the children's hospitals have almost no one in their ICU as COVID. However, there's this other multi-system inflammatory disease in kids, which is sort of a late result of COVID, seems to be, but is not exactly COVID. So most of these kids have antibodies. That most of the kids are no longer contagious with COVID, but they get these high fevers. They get a lot of inflammation in the body. Some have heart disease, and some have died. So yeah, that's a really serious illness. And there doesn't seem to be anything specifically we can do to prevent that other than to just decrease the rate of COVID in the community. While the rate of COVID is high in the community, we're going to get some of those cases. So we really, really, really have to decrease the rate of COVID in the community. So if people are not contagious after 10 days, then why do doctors wear a mask? Well, we should all be wearing a mask for reasons. So, when I'm in the clinic, as I was this week, I wore a mask so that if I was pre-symptomatic, I wouldn't give it to them. Same reason everybody else should be wearing a mask. In terms, though, in the ICU, why people are wearing a mask with sick patients after 10 days is because the new norm, I think, in hospitals is for people to wear masks all the time. So it doesn't exactly make sense that they would wear a mask all the time and then just take it off while they visited you in the ICU. So I think the story is that doctors should be wearing masks probably all the time. I remember back at a time when you drew blood and do all kinds of bloody procedures without wearing gloves. I think people now would look at that and think, Bob, what were you thinking? And I'm not sure what I was thinking. Now, I think anytime we deal with blood, we would certainly use gloves. And I think what we're recognizing in the hospital is that people should be wearing masks. Because if you're in the hospital with COVID, then you may well have something else. You can easily have a secondary bacterial infection or something else, because you can have more than just COVID. You can have COVID and flu or COVID and one of the other germs. So Laura says, what's the best way to protect yourself? Mask and glasses or a face shield? Well, I think any of those are appropriate. So face shield would be great. Mask and glasses is great. There's not been a head-to-head comparison of the two to see which is better, but I think both are perfectly appropriate. I actually prefer a balaclava, a specially made balaclava and glasses, but I think a face shield is fine too. Yeah, so Eileen says, what do you think about the budesonide inhaled steroid treatments that are being tried? So there's one doctor from Texas who's talking about, budesonide inhaled stuff. I have 100% success rate and it's a miracle cure. Okay, so let me tell you about that. So budesonide is something we use all the time, and we even use it on the tiniest little preemie baby. It's a very safe drug that we use for asthma. It's been out for years and years. It's generic, and you can either do it by a nebulizer or you can do it in an inhaler, and it works great for people with asthma. It is a steroid, and we think that steroids may help people who have severe COVID. Remember that story about Decadron that showed that if you have severe disease where you require oxygen or you're in the ICU, Decadron seems to help. So that if you were in that situation, an inhaled steroid might help. However, the Decadron study suggested that if you weren't in that group, that it actually might hurt. This guy is giving budesonide to people who are not in that group, and he says they don't seem to get very sick. Well, most people with COVID don't get very sick. So, I hear this guy, it sounds pretty convincing. The next thing to do is to do a study. And so the story is you treat, you find 50 people have this, half get treated with budesonide, half get treated with saline, and you see if there's a difference between the two. I mean, this is what we would call an observational study. Geez, I recognize when I put my tomatoes in this area or not, it seems to get better. There's lots of reasons your tomatoes might do better in one area than not. But then to say it's because it's this one area is a little early. So that this guy found that budesonide seemed to help is a great thing. And I think we really need then to do a controlled study to see. The problem I note with him is this is several weeks old. And the story is in several weeks, with 70,000 cases a day, we should be actually able to know within a short time whether it works or not. So in this whole COVID thing, there have been at least 20 different things that have been suggested that they may help and they may not help, and then they get into a controlled study and you find they didn't help at all, or sometimes even hurt. So for example, hydroxychloroquine is one of these, and we've gone back and forth about hydroxychloroquine. And to add to the furor over that, there was an observational study from Henry Ford Hospital that came out today that suggested that it might help, but it was really observational. It wasn't controlled, and I don't know what to make of that. My plea to people is, I don't know what works and what doesn't. Nobody knows what works and what doesn't. But that's why we should actually test and see. Now, the one thing that was actually very adequately tested was remdesivir. It does seem to help a little bit, decrease the length of stay. Doesn't really change the death rates. So yes, we should do remdesivir. The Decadron study that was done at Oxford was very well done. Lots of people in each group. They looked at a lot of important things, and it really did seem to help people who were sick enough that they needed oxygen or needed ventilation. So I would go with that. Everything else, I think it's still up in the air, and I don't know. So Crystal says, are our cases still due to travel, or are we seeing some community spread now? I think we're seeing a little bit of community spread now. Now, what happens when we have cases, we try and pull them all together. Still, most are related to travel. So most of them, when you go back, it was related to somebody either from Douglas County went out and brought it in, or somebody came from another place and brought it to us. So many of these are related to travel, but there are a couple of cases lately where we haven't been able to find the link. And so we do worry about that. And that's what you would expect, that early on, your cases would come from travel. But if you didn't find them all, then what would happen is some of these cases would go around, and then the link to travel would be so distant that you wouldn't be able to figure it out. So please be careful about the travel so we don't bring it in the first place. And then second, if you do have symptoms, please get tested. So Michelle says, is this new strain less deadly? I actually looked at the actual paper today and pulled the quote out. And the quote says, and I'll read it to you. The quote says, I send a lot of emails. So the quote specifically says, so what I wrote was the 614 mutation is very interesting. There is a suggestion that transmission was increased. And the quote from the article was, quote, interestingly, we did not find evidence of G614 impact on disease severity. That is, it was not significantly associated with hospitalization status. However, an association between G614 variant and higher fatality rates has been reported in comparison of mortality rates across countries, although this kind of analysis can be complicated by different availability of testing and care in different nations. So I don't think there's anything in here to suggest it's less deadly, and if people know different, please let me know. Yeah, so Donna says, how do we know with a high degree of confidence that little kids get it less since they aren't tested much? Could they be asymptomatic carriers? Yeah, and I think the answer is kids are tested less, so we do know less about them, but other countries tested them a lot. So China did test them a lot, and they really did have lower rates. They've also done antibody studies since, and they have lower antibody studies. So I think in the areas where we've looked, they really do get it less. Now, the way we'll know this is when we have an easy test we can do for kids. Now, I was at the testing clinic today, and we did 60 some odd tests. These are really nasty tests, getting back in the nasopharynx. And, once we get an easy test like you could do with saliva or something else, it's going to be really hard to test a lot of kids because kids will definitely need to be held down for this. So how do you feel of Saturday's Corona cruise? I don't know what a Corona cruise is. It's going to be like a graffiti where people are going to drive around. Well, again, if people are socially distanced, certainly being in your car is socially distanced. If they're doing it outdoors and there's not big crowds, then go for it. Ryan says, it seems that many cases are asymptomatic or mild symptoms. Any thought on the reasons? I don't think that's true, actually. When we looked at the cases lately, there are some asymptomatic cases. And usually those asymptomatic cases have been found because they were contact of symptomatic cases, and we tested them. Actually, I've talked to a bunch of these people. Some of the people were mildly ill, but some of the people were pretty sick. And some of the people say, this is the sickest I've been in 10 years. So I don't think so. We've had a new hospitalization in the last little bit, a bunch of ED visits. So I don't think the overall severity is less. Now, early on, the only people we were testing were people who were likely to be hospitalized. And so, yeah, early on, the cases would be sicker because we weren't testing contacts, and people with mild symptoms, there weren't enough tests, so we weren't testing them. So that overall, the complexion is a broader testing, but I still think we're seeing the sick people. So Candy asked the question of all times. If you get antibodies, can you get COVID again? Well, we don't know. And that's a great question. And in fact, in one of the details that I've been doing with people, that's the $64,000 question. Now, antibodies are complicated because it's not like antibodies just come out of the blue here. So your body sees an infection or sees an invader. It uses the T cells and the B cells to make these antibodies, and then you get going. When you get exposed again, both the T cells, the B cells, and the antibodies all need to work together to get this going. So what happens is that the T cells say, oh, I see that unwanted invader back. B cells make a lot of antibodies. You make another big surge of antibodies, as well as they tell the other kind of cells that are out there, look, this is a bad guy, get rid of it. And so they all work together to get rid of it. And as an aside, the reason HIV was so bad is because HIV really crippled your T cells. And by crippling your T cells, your body couldn't recognize any kind of infections. And that's why these people had a really weak, poorly functioning immune system. So the question is, if you have antibodies, can you get it again? And we don't know the answer to that. We think with SARS that people probably could fight off an infection for a few months after an infection. We do know with the other coronaviruses that cause colds, you usually don't get that twice in a season, although there was a study looking at people who had coronavirus antibodies, and they challenged them again with these other coronaviruses that cause colds, and they got it despite the presence of antibodies. So the question is, will antibodies in the T cells wake up when they get exposed again? And I don't know, and that's a critically important question, because if they don't, then vaccines are going to be much less effective. So I don't know the answer to that. Again, some really good studies this week suggesting that the T cells do remember and the T cells are going to respond. So that's hopeful, but I don't think we know. So did gas station attendants need to wear a mask? So if you're a gas station attendant, you're outdoors, you're likely going to be somewhat distanced. I think that's not considered to be high risk. So the thing is, indoor public spaces, I mean, unless the gas station is indoors, it wouldn't be that. So Crystal says, I work for an optometrist. So we had a patient that refused to wear a mask due to asthma. We refused to see him. Can we get in trouble? Absolutely not. Protect yourself. People don't want to wear a mask. That's okay, but they don't have to come in and see you and potentially infect you. Now, you know, there are some people who don't want to wear a mask because they have an asthma-like thing, in which case I tell them just wear a face shield. Face shields work perfectly fine. They're easy to wear. Now, you can't obviously do an eye exam with that. So, I mean, unless her not being seen for a while is going to be a big issue, just delay the appointment and do it later. You know, we're not going to be on we're not going to be on a mask mandate and lockdown forever. And, you know, if it's 6 months or so, that would be okay. So Amy says, if we continue to see our cases increase, should we expect to see restrictions step backwards? So I don't know. I really don't know. I know that in places like Texas and Florida clearly have taken a big step backwards. So Texas stopped doing elective surgeries. Texas closed restaurants and bars. Florida closed bars. Other people have considered other restrictions. And these are in places that were absolutely adamant they were going to open. So you can imagine how much it took for Governor Abbott in Texas to say, look, oops, we goofed and we opened too far. Let's close back down. Oregon is not nearly as dire as those states, so I don't necessarily see us taking a step backwards now, but please, 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 let's do it so we don't get there. So what can you do? The stuff hasn't changed. Socially distance, and I will tell you, a couple of our cases have had terrible social distancing. The second is stay home when you're sick. Again, we're seeing a number of cases where people are going to work when they're sick. Don't go to work when you're sick. The third thing is to wear a mask. I think mask usage has really, really improved in the last 2 weeks, so that's good. Wash your hands and avoid unnecessary travel. Could we see a step backwards? Yes. Now, what would a step backwards look like? Well, a step backwards could look like in Texas canceling elective surgeries. A step backwards could look like smaller gathering sizes. It could be only takeout at restaurants. Boy, we don't want to go there. I saw a story this week about a restaurant that had opened, hired everybody back, but then needed to close again in a different state, and how demoralizing that was to the business. I mean, did they have to fire these people again? Did they go on furlough? This enhanced unemployment benefit, which really helped a lot of our workers through this thing, is going to be gone. And so many of those people going to be unemployment, getting very low unemployment checks, are really, really, really going to be struggling. So, the decision to go backwards is going to be based on the number of cases and the severity of cases we have. It's not going to be made on a whim. And the only people who can prevent that are us, right? It's just us that can do this. We're the ones who can avoid unnecessary travel. We're the ones who can wear a mask. We're the ones who can socially distance. And we're the ones who can stay home. So please, please, please do that. But if it gets worse, it's certainly not inconceivable that we would take a step backwards. I think Arizona is going to have to do that soon. Arizona had a lot of cases today, and they're really, really stretching their society. And I will tell you, the stretch in those areas, although we've not that many cases in Oregon, is hitting us. So what we're seeing is that, for example, the testing materials are in short supply. There was a note from the Oregon Health Authority today to prepare for shortage of testing supplies again. There's a shortage of PPE again, and the test delays are happening again. So this is happening in those areas here, and if they don't get their outbreaks under control, it's going to get worse, and if it gets worse, we may start to see things move backwards. Okay, well, a couple of things. I saw some funny and interesting things this week. One was something from the Texas Medical Association that we'll send out, and they asked a bunch of experts of various different activities, what's the risk of doing these, and put them on a scale of 1 to 10. It was one page, beautiful to see. It was like playing singles tennis. Pretty low risk, like a 2 out of a 10. Going for a walk outside, 1 out of a 10. Going to a concert indoors, probably 9 or 10 of 10. And so it had all these risk layers of where it would be. And it was great because it was 50 common activities. And so you get sort of an idea of where you would go. In addition, Oregon Health Authority put out a graphic, which we'll also share with you, about 4 questions to ask. Tell me about the kind of activity. Indoors, much worse than outdoors. Big activity where you can't socially distance, much more risk than a group of 1 or 2 or 3. With people in the area, much less risk than people who are coming from out of area. So again, 2 very excellent ways to go ahead and look at the activities you're going to do to see what the risk is going to be. And right now, I would be cautious with any activities which are higher than a risk level of 3. The other thing that I saw is people said, how should I treat my mask? And there's been a lot going on. And it's a cute little thing, and it says you should treat it like your underwear. You shouldn't wear it if it's dirty. You shouldn't share it with others. If it gets wet, you should get a new one. You should always wear it. You shouldn't wear it inside out. So it was a really cute little thing about how you should take care of your mask and take care of it like your underwear. Was, I thought, excellent advice. All right, looks like we're running out of questions. I'm running out of steam. It's been a long day. So again, this is Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Just a few things. Please, please, please take care of yourself. People have been incredibly kind to us at DPHN, and so please continue to be kind. I thank you for that. And please socially distance, stay home if you're sick, wear a mask if you can, and be really careful about travel. Thanks.